Hi, everybody. I'm Dan, and I've got Dr. Bilski here. How are you today?
I'm good. Good morning.
Good morning. So we thought we'd go a little bit casual, let people see you in your regular skin.
So today's my day off, so it's a perfect time to talk about this.
Yeah.
Normally on my day offs when it's cold, I have my vest. It's heated vest. Love it.
Nice.
My Carhartt hat.
Okay.
And I usually have my work boots on so I can just get in my truck and just kind of drive around.
I'm just geeking out about a heated jacket. Should we talk about that rather than dental here?
Anytime that I don't have to talk about teeth or give anybody bad news, let's talk about a vest for sure.
Yeah. That's pretty sweet. Yeah. We do have a topic though. Tell us about this topic here.
This topic that we're going to discuss today is it's called the All-on-4.
Okay.
And what that means is you could have lost your teeth. You've been wearing a denture for a long time. And it doesn't fit anymore. It's loose. You get food underneath it. It's not secure. It pops out. Your grandkids may say something. Mm-hmm. It hurts. Mm-hmm. Sometimes there's an odor that gets in with the denture. So now you're just tired of it.
Right.
And it's time to get something that's more permanent. More permanent meaning it stays in your mouth. You brush it with the spin brush or an electric brush, and you water pick it. So no more floss.
Okay. Wow.
And it's very, very natural looking.
Okay.
As compared to something that's artificial that you put in a dish every night.
Okay. So let's go a little bit further with this one. Is this like a surgery or what's the procedure behind it?
It is a surgery.
Okay.
It's a surgical technique. It's called All-on-4 or Smile in a Day. The term All-on-4 started a long time ago. It's actually, we call it All-on-X, and X would be equal to the number of implants that we place in what's called an arch. So your upper teeth is the upper arch, the bottom is the lower arch. It's usually 4, 5, or 6 implants. Larger people may have 7 or 8, but most of the time it's in that 4 to 6 range.
Okay.
So for today, let's just call it All-on-4.
Right.
And what that means is surgically placing 4 implants in the upper jaw, lower jaw, or sometimes we call them dual arches, upper and lower, together.
Okay.
And we do that in our office. We can have an anesthesiologist come in, or you can be on an oral medication that just kind of makes you happy. We call them happy pills.
All right.
And those that maybe drink alcohol and they have that second martini, it's just kind of like, okay,
so
doc.
they're just kind of relaxing as this happens.
Yeah, and we know it's scary to come into the dentist anyway, so we keep it low key. Everybody is very nice.
How long does it usually take for this procedure?
That's a good question. So some that I have already come in with out teeth, you're missing teeth, and you have a decent sized ridge, it's called, or jaw.
Okay.
Could take us about an hour and a half to 2 hours.
Okay.
And then we have the patients that have a lot of gum disease and the teeth have to come out. So there's a lot of management of the arches to get that to a point where we can get the implants in.
Right.
It's all done digitally.
Okay.
So as an example, Dan, so say you came in.
Okay.
And you have your teeth now, but you know that it's time to go. You have a terminal smile. You've come to the conclusion after many months of thinking about it, you're going to do the procedure.
I would do it in a heartbeat.
Okay. We take a scan, an x-ray. We also use a scan intraorally. That means take a camera and scan the inside of your mouth. Mm-hmm. No more putty molds.
Okay.
Send that to our laboratory, and then we do a proposal.
That's pretty cool.
Virtually, we do everything before you even come in.
Wow.
And then we'll bring you back to show you all the pieces, parts that we're going to use.
Yeah.
And then we schedule the appointment. So it could be anywhere from 3 to 6 hours. What we're finding is most patients that are at this point, they've spent a lot of money in and out with root canals, broken teeth. Back when I went to school, that was 33 years ago, we were instructed and trained to save everything at whatever cost to whatever extent. Mm-hmm. 33 years and being pretty realistic and reasonable, I feel, is that sometimes you need to have the discussion. Is this something that you want to do? Mm-hmm. Are you okay with removing the remaining teeth? And that oftentimes is yes, more than no.
Right.
So we move forward and
Yeah.
do the all-on-4, place the teeth. You wear a temporary bridge for about 3 or 4 months.
Okay.
Then you come back for the final restoration, which means the final teeth.
Okay.
They're screwed in. Only I can take them out. It sounds horrifying, but it's a very easy procedure after that surgical appointment.
Mm-hmm.
A lot of happy
This
people.
history.
Yeah.
So how do these guys get in touch with you? Is this as easy as a phone call or?
A simple phone call, yes.
Okay.
Call my office, ask for Lindsay, Karen, Sophia, or
Okay.
Sarah, and we'll move it forward.
That sounds great. So guys, simple phone call or fill out the website form online, and Dr. Bill C's team would be happy to help you out.
For
Thank
sure.
you.